Hello, good evening.
Good evening po, Doc.
Pwede na ba tayo mag-start? 102 lang kayo? Ngayon?
We're supposed to be a bit more, but I don't know where are the others po.
To absent sick, please. Okay. So let's start now, no? So this would be our last lecture. However, we will have our small group discussion or maybe ano na to, titingnan ko muna kung ano yung mas magandang gawin. Small group discussion or take space. Okay? Sa Monday. Okay? So, since this is the last lecture, then we'll make it a bit exciting. Sana exciting, no? Wait lang, ha? Okay. So our topic for today, for this night is good evening, Dr. Simbran. Okay. So our lecture is about the basic approach to pain management. Okay. Since I am an anesthesiologist, then my my everyday goal in all of my patients should be, all of them should be pain-free. Okay? Kung hindi mo man makontrol yung pain, it should be tolerable. Okay? Okay, what is pain? So, from the Latin word pione and the Greek word poine, meaning penalty or punishment. It is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain is usually subjective and it is modulated by higher centers and affected by your emotions and affective component. Okay? So we have pain receptors, which are also known as nociceptors. They are usually free nerve endings located in the skin, muscles, bone, and connective tissue. And also, there are also, this includes also the bradykinin, serotonin, prostaglandins, potassium, and hydrogen. Okay. How about the neurotransmitters for pain? So these include glutamate, substance P, aspartate, and glycine. Okay. So we also have nerve fibers for your pain, as we have discussed before. We have your A delta and your C fibers, diba? Sabi ko nga sa inyo, A delta is mainly concerned for your sharp sensation of pain, while your C fibers is responsible for your slow pain. Okay. So what is nociception? It is how pain signals get from site of injury to the brain. Okay. It can be altered by many factors in the periphery, in the spinal cord, and in the brain. It is not the same as pain perception. Okay. So pain perception, it is how we feel pain. That's why each of us have different perception of pain. Sometimes even if you are already durog na durog, di ba? Pag wasak na yung puso mo, okay pa rin. Pero some people, kahit na konti lang, nakita lang niya yung loved one niya na may kausap, so nadudurog na yung puso niya. So, different. Every individual has different perception of pain. Okay? So, heartache is also pain, di ba? Okay, so pain perception depends on many other factors, including beliefs or concerns of the individual, psychological factors such as anxiety and fear, cultural expectations of the individual, other illnesses, coping strategies, and social factors such as family or work. Okay, so if you have a strong family background or family support, then you may have better coping mechanism for pain. So now we have here your normal pain processing pathway. We have the step one, which is when the injury is given, and then you will have your step two, wherein wait lang, marami pang pumapasok. Okay. Your impulse, the impulse from afferent depolarized dorsal cord neurons, then extracellular potassium diffuse into neurons, causing the release of pain-associated neurotransmitters such as your glutamate and substance P. And then after that, it will go to your third pathway, which wherein a signal is sent via the ascending tract to the brain and perceived as pain. So what is the ascending tract again? Good evening. Is it spinothalamic tract or thalamo-spino tract? Ano yun? Spinothalamic tract. Very good, Dr. Sancho. Okay, the ascending tract is the spinothalamic tract. Okay, yun na. Spine, from your spine to thalamus. Okay, that's the idea. That's the hint. So after the third pathway, you will have the fourth, which is the descending tract carries modulating the impulses back to the dorsal horn. Okay, and then the patient will react. Okay, excuse me lang. Nakatutok kasi yung electric fan. Okay. Okay. So now, this is the more explained pathway. So when you have the stimulus or injury, it will cause release of your chemicals such as hydrogen ions, prostaglandins, and then these substances stimulate pain nerves such as nociceptors, which are bradykinin, serotonin, prostaglandin, through your A, delta, and C fibers. Okay, the body also responds to the damage by releasing inflammatory substances such as your substance P, which increase nociceptor stimulation. And then the pain signal travels along the A, delta, and C fibers through the dorsal root to the dorsal horn of the spinal cord. Okay, na-imagine yun. So, and then this is also known as the transduction, wherein the event whereby the noxious thermal, chemical, and mechanical stimuli are converted into an action potential. Okay, remember that everything happens in your body is through your action potential, even the pain. Okay, so yun pa rin, yung phase 1, phase 2, phase 3, phase 4. So when you have an exchange of your sodium potassium, then you will have an action potential. Then the pain will be conducted, okay, to the brain. Okay, lahat-lahat ng nangyayari. Okay, so the second pathway is when the dorsal horn of the spinal cord, in which you have your first relay station. Okay, this is vital area for two main reasons. The second order pain nerve crosses to the other side of the spinal cord and travels up to the spinothalamic tract to the thalamus at the base of the brain. Okay, tandaan ninyo. Spinothalamic tract ang ascending tract for your pain. Okay, then the A delta and C fibers connect with second order pain nerves, and the input from the peripheral and spinal cord nerves may change the signal. Okay? So this is called transmission. Okay? This is when the action potential is conducted through the nervous system via the first, second, and third order neurons. Okay? Medyo pinapakomplikado lang natin ng konti. Okay? So the third pathway is when the thalamus is so you have to remember that the thalamus is the second relay station. There are many connections with other parts of the brain, including cortex, limbic system, brainstem. The cortex is the main area responsible for us being aware of the pain. Okay? This is also known as the pain perception. So ito na yung marami pang humahapon. Okay. Ito na yung stage kung saan napaperceive mo na yung pain. Okay, the limbic system is responsible for many of the emotions we feel when we experience pain, such as anxiety and fear. So, if the person is not that he has no strong family support, or not very weak yung kanya, yung fighting spirit niya, then the patient may feel more pain than as compared to other people. Okay, so then yun. So that is also known as modulation, where you alter your afferent neural transmission along the pain pathway. Okay? Either inhibition or augmentation of the pain signals. Ito na yung, kaya nagkakaiba-iba tayo. You, me, and others have different pain perception because of modulation. It can be inhibited or augmented. Okay? Some patients, kahit na ginalaw mo lang, ginanito mo lang, very painful sa kanila. Okay? Those are augmented, yung signals nila, yung pain signals nila. But sometimes, some, kahit na nadurog na yung kamay niya, wala pa rin siyang pain na nararamdaman. So, inhibited yung modulation. Okay? Ay, asan na siya? Bakit nawala? Sorry. Bakit nawala? Ay. Sorry, nalilito na kayo sa slide ko. Medyo nag-fast forward naman siya. So the fourth stage is the perception of pain, the final common pathway. Okay, the integration of painful input into the somatosensory and limbic cortices. Okay. So those are the pathway of your pain. So you have your injury, and then it will go through your spinothalamic tract, and then it will be perceived by your cortex, and then you will have a somatosensory or perception of pain. Okay? So now, again, what is pain? Anyone? Can you describe pain personally on your own words? One word na lang. Anyone? What is pain? Discomfort. Okay. What else? Sensation. Okay. Unpleasant feeling. Okay. If I am smiling, am I feeling pain or not? But then I told you that I'm feeling uncomfortable. I'm feeling pain on my eyes, but I am smiling. Is that pain? Are you going to treat it? if I am smiling, but I told you I am in pain. What? Yun na nga. Okay? So, according to international, it could be po. Okay. Okay. Sige. So, according to International Association of the Study of Pain, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Okay? However, pain is like a rot, something that causes a lot of suffering but is often hidden from view. Okay? Sometimes patients will come to you smiling um, but will tell you that I am in pain. Sometimes your friends, masakit yung dibdib ko because I'm heartbroken. So that's pain also, di ba? So that's why pain is what the person says it hurts. Okay? Even if the patient is smiling, but then if she told you that she's in pain, then you have to address it. Okay? Huwag na yung sasabihin ang arte-arte. Ganon. Ay, naku, napaka-arte niyan. Ganon. Sometimes, di ba, when we deal with difficult patients, sasabihin sa'yo, oh, Doctor, I'm having a pain. At 2 a.m., di ba, maiinis ka pag ganon. Pero, as a doctor, as a good doctor, you have to address that. Okay? Because pain is what the person says it hurts. Okay? Kahit na anuman yung itsura niya, pag sinabi niyang in pain siya, you have to address. Okay? So now, what are the classifications of your pain? So we can classify pain according to the duration, the cause, and mechanism of the pain. So you have to ask, how long has the patient had pain? Okay, what is the cause? What is the pain mechanism? Okay, so for us to classify it, so you have to ask the duration of pain. So ask if the patient is acute, then the pain will be less than 3 months. Okay, if for acute pain, it is mostly poorly treated, and it is more likely to become chronic pain. Okay, if it's poorly treated pala, it is more likely to become chronic pain. Okay, tandaan ninyo, pag less than 3 months, then it's acute. However, if it's more than 3 months, it can be chronic pain. Okay, or persisting after an injury heals. Okay, sometimes patient may experience additional acute pain, especially for cancer patients. Okay. Okay. So again, acute pain less than 3 months. Pag hindi nagamot, it may become a chronic pain. So for acute pain, you will feel sudden, normal, predicted physiologic response to an adverse chemical, thermal, or mechanical stimulus. It will usually resolve within 1 month. Okay. Under these are visceral pain, which is nociceptive pain that comes from internal organs. Also, activation of pain receptors in the chest, abdomen, and pelvic area. Okay. Pain, such as cutaneous pain from skin or subcutaneous tissue. Okay. For deep somatic pain, for periosteum, muscles, tendons, joints, strong pressure, ischemia, or tissue damage. Okay. So example ng visceral pain, if you have MI, for deep somatic pain, pwede ring MI. Okay. For superficial pain, pag nasugatan ka, so you will have an acute pain. Okay. And then for your chronic pain, which is usually more than 3 months or after an injury heals, you will have a persistent episodic pain of duration or intensity that adversely affect the function and well-being of the individual. It is usually nociceptive, inflammatory, or functional in origin. So, examples of your chronic pain is chronic malignant pain, wherein 60 to 90% of your patients with cancer will go into chronic pain. Okay? Non-malignant pain such as non-cancer pain na that lasts for many years and progressive in nature. Okay? Example of these are neuropathic, nociceptive, or mixed in nature. Okay? The last one is neuropathic pain, wherein you have an injury or malfunction of the nervous system. Okay? So, chronic malignant pain, syempre, pag may cancer ka, di ba? Non-malignant pain. Example of your non-malignant pain. Ano? Can you give non-malignant pain, which is chronic pain? For patients who have DM, sometimes they have sciatic nerve injury. Then, that's non-malignant pain. But then, pwede din siyang pumasok sa neuropathic pain. Okay? So, mix na. As long as you know, rheumatoid arthritis, it is more sa acute pain. Okay? Dito sa acute pain, tingnan niyo dito. Dito sa deep somatic pain. Sa tendons. Okay? Wala namang nagre-rheuma ng more than 3 months. Acute lang, di ba? Siguro magkakaroon ka ng pain, siguro maximum na ng 1 month. Tapos pag nag-treat ka, mawawala. Okay? So, rheumatoid arthritis is more acute pain. Okay? Than chronic pain. Okay, the next classification of your pain is according to their causes. Okay? It can be cancer pain or non-cancer pain. Okay? For cancer pain, it is often chronic pain, but the patient may get acute pain as well. Ito na yung sinasabi ko sa inyo. Hello? Yeah, I'm lecturing. Pasensya na. Tumilip yung pamangkin ko. Okay, so the next is your cancer pain, often chronic pain, but the patient may get acute pain as well. The pain tend to get worse over time if untreated. Example of this is pelvic pain due to cervical cancer, bone pain due to cancer spread to bones. Okay? While for non-cancer pain may be acute and last for a limited time or may become chronic. The cause may or may not be obvious. Okay? This include surgery or injury, degenerative disease, headache, childbirth, nerve compression or injury, or no obvious cause. Psychological effect lang. That's why even, yun nga, sabi ko sa inyo, kahit na ginanon lang, pero painful na sa kanya. So, that's more psychological pain. Okay? Okay? The next way of classifying your pain is through their mechanism. Okay? For mechanism, it's either nociceptive, neuropathic, or mixed. Okay? For nociceptive, it is also known as physiological pain. It is the commonest type of pain following tissue injury. Okay? It is usually caused by stimulation of pain receptors in the tissue that have been injured, described as sharp, throbbing, or aching pain. It is well localized. Okay? Sasabihin ng pasyente sa'yo, masakit po sa dito po, gano'n. Dito, gano'n. Specific. well localized. However, for your neuropathic pain, which is also known as pathological pain, which is usually caused by damage to or abnormal function of the nervous system, um, wherein you have tissue injury that not not that too obvious, and the effects is nerve damage, wherein you have your abnormal firing of nerves giving pain without stimulus, or increased number of pain signals from the spinal cord to the brain, described as shooting or burning pain, numbness, or pins and needles. And it is often not well localized. Example is example is trauma, cancer, amputation, or TM. Okay, so again, for mechanism, you have your nociceptive pain, which is physiologic pain, well localized, described as sharp throbbing or aching pain. Okay, while neuropathic, it is pathological pain, described as shooting, burning pain, numbness, and pins and needles. So, usually abnormality of your nervous system ang cause ng neuropathic pain. Okay, and it is often not well localized. And you may have mixed nociceptive and neuropathic pain. For example, for trauma, trauma of the hand. So, ang dami-daming nerves dito, di ba? So, you may have nociceptive and neuropathic pain. However, if you have trauma here, then you will only have either nociceptive or neuropathic in the long run. Okay? Basta pag may nerve injury, you can have mixed nociceptive and neuropathic. Okay? Naintindihan ba so far? Bakit nawala? So, what are the classifications of your pain again? They are classified according to the duration, according to the cause, and mechanism. So, tatlo lang ang ways of classifying your pain. Under your duration is your acute and chronic. Acute if less than 3 months. Chronic if more than 3 months. Okay? And then for the cause, can be cancer or non-cancer. Obvious naman yung cancer, di ba? Non-cancer, it can be injury or pwede rheumatoid arthritis. Okay? And then for the mechanism, you will have 3, di ba? Nociceptive, neuropathic, and mixed. Okay? For nociceptive, it is well localized, while neuropathic, not well localized. Tapos mixed, syempre, pag combine mo yun. Okay? So, easy to classify your pain, di ba? May questions pa ba kayo doon? Class? May questions ba kayo doon sa kung paano ninyo ito classify yung pain? Kasi, for you to treat the pain, you should know first the classification or diagnose first. Okay? Tandaan ninyo, sa medicine, you cannot treat something that you don't know yet. Na you don't diagnose it yet. Okay? Hindi pwede yung mag-treat ka na tsaka ka mag-diagnose. Hindi pwede. You have to diagnose it first and then treat. Okay? Intindihan? Class? Okay. Now, we'll go to the basic approach to pain management. The proper management of your pain is through your RAT system. Okay? So, RAT, since pain is like a rat, which is hidden and sometimes unrecognizable or unseen, then we're going to manage it through RAT system also for us to remember. Okay? So RAT, recognize, assess, and then treat. So how are you going to recognize? Okay? So sometimes we forget to ask whether the patient has pain or not. And sometimes patients don't or can't tell us. If you don't look or ask, you don't find. Okay? So remember, you have to ask. Okay? Sa lahat ng pasyente ninyo, every patient that you handle, please include pain as your fifth vital sign. So what are the vital signs again? That you're going to get every time you see a patient. Ano yung mga vital signs? Can you give one vital sign? Dr. Yadav. Hello?
Yes, Doc.
Oo. Can you give one vital sign? That should be, give one vital sign. Is BP a vital sign or not?
Yes, Doc. BP is the vital sign po.
Yes. Diba? Whenever you have a patient coming to you at emergency room, then you have to get those vital signs for you to assess the patient. Okay? So, BP, tama. Sino yung nagsabi nung saan na ba yun? May nag-text, may nag-message eh. So, 1, BP, heart rate, RR, temperature, SpO2, or O2 saturation. So, please include your pain as your fifth vital sign. Okay? You have to ask every patient if she's in pain or not. Okay? Kasi it's very important to address your pain. Okay? And sometimes, diba sabi ko kanina, sometimes some patients are smiling even if they are in pain. So, or sometimes they are hiding it. Kasi maybe they are afraid or they are not comfortable to show it to other people. That's why they are hiding it. Then you have to look for the signs of pain. Okay? Look for any signs of frowning, if the patient is not moving easily, or if the patient is sweating. Okay? Those are the signs that the patient is in pain. Okay? And also, you have to ask other people who knows the patient. Okay? Sometimes the patient is accompanied by his relative, then you can ask them. Sometimes patient coming to you are deaf or mute, so you cannot assess, you cannot ask. Then you have to ask the relatives of the patient or other health workers that knows the patient. Okay? So, tapos na tayo sa recognize, di ba? And then next one is you to assess. Okay? To treat pain better, we need to think about the cause and the type of pain. We may be able to treat the injury that is causing the pain. We may also be able to choose better drugs to treat the pain itself. That's why you have to assess. That's why you have to know the classifications of your pain for you to diagnose the patient and then treat the patient properly. Okay? So you have to ask the patient. You have to ask yourself: and the patient. How severe is the pain? Okay? Okay. Paano ko siya malalaman kung severe, moderate, or mild lang? So you have to use the pain score. Okay? Okay. So you have to ask the patient if ilan yung pain score niya at rest. Okay, versus the pain score of your patient with movement. So it's the patient. So can the patient move? Can the patient cough? Or can the patient work? Okay, sometimes patients who are in pain cannot even move or cannot even go to work because of pain. Okay, those are important to ask. So these are the examples of scoring your pain. So through visual analog scoring, and you can ask the patient from 0 to 10. So for pwede siyang siya na yung mag-i-score, and then you can show it the visual analog scale kung nakasimangot or nagka-cry na siya. So 10 na pag hindi na niya matolerate. Yung 0, no pain at all. Okay? And then the 10 is the worst pain. Siya yung mag-i-score, ha? Hindi ikaw. Siya yung pipili ng scores niya. Kasi hindi naman ikaw yung nakaka-feel ng pain. Okay? And then, so how are you going to assess? So again, what type of pain is it? Is the pain acute or chronic? So the cause of acute nociceptive pain may be very obvious, but chronic pain may be more complicated. In chronic pain, psychological factors may be more important, and the pain may have both nociceptive and neuropathic features. The pain may be acute or chronic, such as in cases of fracture in a patient with chronic cancer pain. Okay? So another question is the pain cancer or non-cancer pain. Okay, does the patient's disease explain the pain? There may be an obvious cause of the pain that requires specific treatment. For example, fracture needing splinting or surgery, infection needing cleaning and antibiotics. Okay, especially for sometimes cancer pain, pag mayroon ng non-healing wound sa cancer area, the patient may need cleaning or antibiotics, okay, to lessen the pain. Okay, and then you have to ask also, is the pain nociceptive or neuropathic or mixed? Neuropathic pain is more likely in some situations such as diabetes, nerve injury, or chronic pain. You have to ask the specific symptoms such as burning or shooting pain, pins and needles, numbness, and phantom limb pain. So, what are the other factors contributing to the pain? So, you have to check for any physical factors or other illnesses, for any psychological and social factors. Is the patient having a depression, anxious, or siya ba ay galit, or is the patient lacking of social supports or family support? Then you have to know that also. So for the T, tapos na tayo sa assessment, di ba? T na tayo. So treatment. Treatment can be divided into non-drug and drug treatments. Okay? Both types are important in the treatment of your pain. Many factors may be contributing to an individual patient's pain, so there is no set list of treatments. The exact treatments will depend on the individual patient. the type of injury or disease, the type of pain, and other factors contributing to the patient. Okay? So, depende sa individual. Okay? Walang box, walang ano na to, walang magkakaparehas na treatment for each patient. Okay? It's different depending on the needs of your patient. So the non-drug treatments include your physical and psychological. For physical treatment, you should know the RICE, RICE. So you have to rest, put some ice, do compression, and elevate the injured area. Okay? If you need surgery, then um, go to surgery. Okay? Operate the patient. And if the patient needs nursing care, then you can give nursing care. You can also do physical treatment through acupuncture, massage, or physiotherapy. Okay. While for psychological non-drug treatment is you're going to explain or reassure the patient, explain the situation or the status of the patient to the patient mismo and to his or her family. Okay. Also, you can also ask the social worker or pastor if kailangan. Sometimes kasi spiritual or ano na to, talking to pastor or a priest will it will give comfort to the patient and sorry, napupulog na. It will boost the morale of the patient. Pag mayroon siyang spiritual support. Okay? So now for the drug treatment of your pain, for nociceptive pain, according to WHO analgesic ladder, this ladder is very helpful for mild to moderate pain. So you should, dito like, papakita ko na lang mamaya yung WHO analgesic ladder. Okay? So you should start from regular simple drugs and then going up. If the pain is is also going up in the yung ladder niya pag nasa moderate, severe, then you can give your morphine or other opioids if the pain is severe. For neuropathic pain, also you can use the WHO. And also you can use your TCAs such as amitriptyline and anticonvulsants. Okay, ito na yung mga examples of your simple analgesics. Simple analgesics such as your paracetamol, NSAIDs such as aspirin, ibuprofen, diclofenac. For opioid analgesics, they are codeine, morphine, petitine. Okay. Other analgesics, ito yung TCAs, anticonvulsants, lidocaine, bupivacaine, tramadol, or ketamine. Okay. Ito. This is the WHO analgesic ladder. So, at step 1, if you have a mild pain, then you can give non-opioid analgesics such as paracetamol and non-steroidal anti-inflammatory drugs such as ibuprofen. And then, if the pain is getting worse, then you can go to step 2, where you can use your weak opioids such as your tramadol. And then if still the patient is in pain despite giving weak opioids, then you can go up to the step 3, which is giving your strong opioids such as your morphine, methadone, those one. Okay? And then if still not the patient is not responding, then you can opt to insert epidurals. Pero the drug that you're going to use is still opioids. Okay? So remember, class, if you have an acute pain, you should start at the higher uh, higher kind of pain reliever and then going down. Okay? If you have chronic pain, usually you start at the bottom, at the weakest drug, and then going up. Okay? Para hindi magkaroon ng tolerance yung pasyente. Kasi especially for cancer patients, usually the pain is chronic. If you're going to start at the higher dose of or higher pain reliever, then the patient may develop tolerance. Okay, so you have to start at the lower, milder pain reliever, and then going up. So, according to WHO, medicine should be given by mouth so that the medicines can be taken at home, okay? And by clock. So it should be regularly taken. And yun nga, it should be given by the ladder. Sabi ko nga, especially for chronic pain, it should be gradually giving your bigger doses and stronger medicines until the patient is pain-free. Okay, if the patient is already pain-free, then stop at that level. Okay, if still not responding, then you can go up. Okay, especially for chronic pain. Okay, so again, for the individual, there is no standard dose of morphine. Okay, it depends on the patient. Okay, the correct dose is the dose that relieves the pain of your patient. So what are the benefits of effective pain management? The benefits for your patient is it is a humane thing to do, no? So kahit nasabihin mo na mamamatay na yan, 2 days na lang, wag mo nang bigyan ng pain, no. Dapat you should remember, you should be passionate and give all your best to your patient, even if the patient is dying. Okay? So, kailangan pain-free siya bago siya pumanaw. Okay? Because it will give greater dignity and less suffering, especially for patients dying with cancer. Okay? And also, mas comfortable din sa kamag-anak niya na makita niya na matiwasay siyang namatay. Imagine mo, if the patient is dying and yet she's in pain, di ba? It's so, ang sakit sa loob. Di ba? Okay? So it will, again, the benefits, one of the benefits also is the physical problems will be lessened. So it will improve your sleep, better appetite. It will cause a quicker recovery after injury or surgery. It has a lower risk of pneumonia, especially after abdominal surgery. Siyempre, pagkatapos mong maoperahan at in pain ka, di ba, you're not going to move if you're in pain. If you're pain-free, then you can move, you can ambulate freely, di ba? So, and also, if you ambulate earlier, then you have a lower risk of thrombosis. Okay? And also, the patient may have lesser psychological problems. Okay? Um, lesser depression and anxiety. Kasi nga, pwede na siyang lumabas. The patient will not be just lying down or just staying at home. If is pain-free, then the patient is comfortable walking outside and doing his chores. Okay, that's the importance of pain management. Okay, the benefits also will be seen to the family by by functioning the part of that patient. Kunwari, ano na to, breadwinner yung pasyente, then magkakaroon siya ng time, or the patient may go to work as early as he can and function his part as a provider to his family. Okay? And also, syempre pag hindi ka in pain, mas gaganahan kang mag-work. Okay? And the family will not suffer also. Okay? For the society, it has a lower health cost because patients are discharged earlier and less likely to be readmitted. Okay? Kasi nga, di ba, pag early ambulation, then mas malayo ka sa thrombosis embolism. Pag early ambulation, dahil pain-free ka, then mas malayo ka sa pneumonia. Okay? So, the patient may go to work agad-agad, mas maganda. Mas makaka-help siya sa economy ng society. Okay? Okay. Now, we have here the possible barriers to the treatment of pain. Okay? For the drugs, here in the Philippines, the supply may be unreliable. Sometimes, we have a shortage of morphine supply. Okay? Kasi nga maraming, ewan ko, siguro mahal, pero it's not that mahal naman yung morphine. Pero sometimes, the manufacturing firms are not here kasi, kaya siguro mas konti yung supply. Okay? So, appropriate drugs are missing from the hospital formulary. And appropriate preparations are not available. Okay? Sometimes, morphine are only available via IV. Wala yung oral sometimes. So, kung IV lang, then the patient needs to be to have a IV site. So, hindi naman pwedeng nandun na lang nandun, di ba? So, the patient needs to go to the hospital para mabigyan ng pain reliever. So, it's not good then, di ba? So, sometimes, if you have no oral preparation of your morphine, the patient will just tolerate the pain. Titiisin na lang niya. Okay? Okay? And also the one of the barriers is patient's factor. Okay? So patients may expect to have pain. Okay? Sometimes yun nga, psychological. Lalo na pag hindi maganda yung family support ng patient. Okay? The patient may feel pity of himself, like those, and then the pain tolerance is lower na. Okay? Okay? Sometimes also, patients may not seek help, especially for yung mga tatay or breadwinner. So, sasabihin nila, no, I should not feel any pain. So, I should not seek help. I'm strong. Ganon. Kahit na in pain na sila, kahit na hindi na sila nakakatulog. So yun, isang barrier. Okay? And also, patients may see complaining about pain, yan na nga, as weakness. Okay, and also it depends on the people's attitude. Okay, and isa din sa barriers is the system. Okay, we have here in the Philippines, we have no culture of pain management yet. Wala pa talagang yung RAT system is ngayon pa lang ini-implement ng Pain Society. Ngayon pa lang sila nag-i-start. So it's not yet fully implemented. Okay? And also no protocols yet. Okay? And also no forms of recording pain pa. Meron pero hindi pa maganda masyado. Plinaplansya pa lang. Okay? For health workers, we have no enough workers or pain suspect doctors. Here in R1MC, we have a consultant who is visiting consultant. Visiting consultant pa lang siya. So wala pa kami talagang pain consultant na talagang nandito sa R1. So sometimes we need to call her or we need to wait for her to come and ask for her opinions or help. Okay? So, and also workers are too busy. Okay? Especially if the patient is asking for help at 2 a.m. Sometimes sasabihin mo na lang, ay naku, puyat na ako. Yeah, hindi naman yan in pain. But then the patient is in pain. So hindi mo na siya na-treat. Okay? And then again, the worker may not recognize pain. That's the problem. If you cannot recognize pain, then you cannot assess and then you cannot treat. Okay? And then, yun, inadequate knowledge about pain and its treatment, and workers are unable to prescribe or give appropriate drugs. Most of the pain drugs are S2 regulated and they need yung yellow form. So any doctor that is prescribing opioids or any pain relievers needs to be accredited by the PDEA. Okay? Kailangan niya ng S2 license before prescribing those opioid drugs. Yan, tapos na pala. So again, in summary, so how are you going to classify your pain? You have 3. So the duration, which is acute and chronic, the cause, which is non-cancer and cancer, and the mechanism, which is your nociceptive, neuropathic, or mix. Okay? Yun lang. Ang easy lang ha. And then once you know the classifications, then you go now to the RAT system, which is you have to recognize. How are you going to recognize your pain? You have to ask the patient. How is she? Anong nararamdaman niya? May pain ba siyang nararamdaman? Ano yung nag-aggravate sa kanya? Yun. And then, you also have to look for any signs of pain, such as frowning, sweating, or ano pa? Yun. Frowning, sweating, yung mga yun. And then, after recognizing pain, then you can now assess. Okay? How are you going to assess? You have to differentiate. Again, yun. You have to know if it's acute or chronic, nociceptive or neuropathic, cancer or non-cancer. Mga ganun. And then after diagnosing your patient, then you can treat. Okay, what are the treatment? So start from the simplest pain relievers, such as paracetamol and then going up to opioid. Okay? For chronic pain. If you have acute pain, you have to start from strongest pain reliever and then going down. Okay? Naintindihan ba, class? Medyo malabo or medyo naintindihan lang? Hello? Hello? Tulog na kayo? So, simple lang ang pain management. Okay. Thank you, Dr. Marcos. Okay. May question pa ba kayo? So, what are some words that we can say to patient who's in pain? Ano yan? Paano ba yan? Ang tanong ni Dr. Cunha, what are some words that we can say to a patient who's in pain? May we know some of your tips in the art of comforting? How do doctors manage intractable pain? Okay, so you have to ask. So how are you going to ask your patient? So, hello, mommy. Good evening po. Siyempre, you have to have rapport muna. Okay? You have to introduce yourself. Okay? I'm Dr. Olive Nasis Ramos. I'm your doctor for this night. How are you? Ganun ka. So, you have to ask your patient, how are you po? Ganun. You have to be courteous. Okay? And then, if the patient will, ganun lang, yung masungit. Okay po. Ano po bang nararamdaman? Ganun. Tapos, wala naman. Tapos, if the patient is still hesitant, okay, ganun ka na lang. And then, you have to give some rapport to your patient pa rin. Kailangan you have more patience, okay, when you are dealing with your patient, especially for difficult patients. Okay, so you have to ask them, may maitutulong po ba ako? Okay, those are the things that you can ask. Or ano po ba ang gusto ninyong maitulong po? Do you understand? You have to ask your patient patiently. Okay, and then and wait for your patient to open up. Okay? Yung chika-chika, sabi nga nila, 'di ba? Doctors are not there to just demand anything to patients, but you have to see to it that the patient is very comfortable in opening up to you and telling to you how he feels, what are his needs, ganun. Okay? And then you can also ask the family, okay, if the patient is still hesitant. Okay, and then you can also ask the family to talk to the patient that he should cooperate. Okay, sometimes if they talk to their relative, the patient will cooperate. Ano pa? Nasagot ba, Dr. Acuna? Tanong. What else? Basta be patient. Wag ninyong papatulan yung pasyente. If the patient is masungit, then don't stoop to their levels. Okay? Just be patient and be courteous. Pag wala ka na sa harapan niya, tsaka ka na lang mag-rant. Pero wag dun sa harap niya, arte-arte mo, hindi pwede yun. Okay? Remember, the patient is in pain. Okay? You need to address that. Even if the patient is very hesitant or very masungit. What else? May tanong pa ba kayo? Wala na? So you should know how to classify pain. You should know how to recognize, how to assess, and how to treat. Naintindihan? So sa assessment, it is also known as diagnosis of your pain. It can be acute, neuropathic, nociceptive pain, mga ganon. Okay? Yung assessment ninyo. Kasi yun yung exam ninyo. You're going to do recognition, assessment, and treatment. Yan yung hint. While for your ACLS, you will do treatment also. Is it non-shockable, shockable? What is the treatment for that? And then, is it, are you going to do ACLS or BLS? Yung mga ganon. For local anesthesia, konti lang doon. Okay na? Okay na kayo? Wala na kayong question? I hope you understood and see you on Monday for small group discussion. Okay? Okay. Thank you and good night.
Thank you po.
Okay.